Assalamu alaikum. The voice fundamental frequency has a central role in voice perception and voice analysis. In this presentation, we shall go through how a voice sample to obtain fundamental frequency is obtained, how is it calculated, presented, and analyzed. Fundamental frequency is a measure of the rate of vibration of the vocal folds. How many vocal folds vibratory cycle would occur within 1 second, and this is measured in hertz, the number of cycles per second. It is the inverse of the time taken for a vibratory cycle to complete. That is to say, the F0 is 1 over the time to complete one vibratory cycle. In this presentation, we shall go through what is a normal vocal folds fundamental frequency, starting with how the fundamental frequency is obtained, either from a laryngograph or from an acoustic signal, a single measure or a distribution of different frequencies, the speech fundamental frequency, the range of the speech fundamental frequency between minimum and maximum, and the standard deviation, the sigma of the speech fundamental frequency, the speech fundamental frequency contours, like in here, and its distribution as a histogram, whether DFX 1 or 2 or even 3. And then a measure of the irregularity of the fundamental frequency by coherence percentage value, or the scatter plot CFX. We end up with how to read the normative data and check that the voice sample is normal. The fundamental frequency is within normal range. The sample for obtaining the fundamental frequency can be obtained either from a recording of a sustained vowel, sustained for 1 or 2 seconds, or from a speech at a comfortable level of pitch and loudness. The fundamental frequency can be calculated from either electrolaryngograms, where it is usually easier to identify the closure of the vocal folds and mark this to identify the distance between two closures as the time for one vibratory cycle, from which you can obtain the fundamental frequency. The same can be applied to an acoustic signal rather than an electrolaryngograph. Again, identify the time between two full cycles and measure this time to obtain the fundamental frequency. There are issues, however, about automatic obtaining of the fundamental frequency from acoustic signals, especially in patients who have dysphonia and irregularity in the vibratory cycles. We'll come to this at a later stage. There are obvious problems about obtaining just a single measure of the fundamental frequency. The fundamental frequency would keep on changing very rapidly and quite widely during voicing of even a simple vowel. The usual is that we would obtain the idea about the fundamental frequency from a longer period of time, over which we can estimate the changes in the fundamental frequency during this time period, get an idea about the range of frequencies used, the average frequencies, the mean and the median and the percentiles, and also the distribution of how often we use certain frequencies, lower or higher than the median. There exists a huge range of what is considered normal because of changes with the fundamental frequency with age, gender, emotional state, the communicative intent, the mood, and the personality of the speaker. The vocal fold vibration frequency is controlled largely by changes in the stiffness and the tension along the anteroposterior direction of the vocal fold. This is mainly affected by the cricothyroid and the thyroarytenoides muscle, with help and contribution from other laryngeal and extralaryngeal muscles. Also changes in the vocal fold length and the effective vocal fold vibrating mass, together with the extent and the duration of the vocal fold contact, the depth of the medial end of the vocal fold during contact and its contact mode, together with other factors, for example, subglottic pressure. The changes in the fundamental frequency with age and gender can be partially explained by the changes that happen in the vocal folds in terms of opposing factors, increasing the stiffness of the vocal fold with time, and also the effect of the increase in the vocal fold length and mass with time. In the children, the fundamental frequency is usually high, with a very short vocal folds and small vocal fold mass. With increasing stiffness, length, and mass, things start to change. This is a graph of the fundamental frequencies of males with time and females over the years. You could see a steep decrease in the fundamental frequency in men after the age of about 10. There would be a significant drop in the fundamental frequencies to below 150 or so, and then a gradual increase over time with reaching somewhere around 150 by the age of 60 or 80. In the female, the decrease in the fundamental frequency with time is much milder, no much change between 20 and 40 years, and then a gradual decline in the fundamental frequency before rising up again towards the age of 70 or 80. The changes in the fundamental frequency over age in both women and men was reported in several studies. Among these, a study of women who had their voice recorded in 1945 and then recorded again in 1993, the same woman reading the same passage, and the group mean speaking fundamental frequency in 1945 was about 230 Hz and dropped at 1993 to about 180 Hz. On a similar note, the recordings of voice of different age groups of men between the age of 20 and almost 90, 25 males in each of these decades. The average frequency remained almost stationary between the age of 20 up to the age of 70, and then increased later in life. And this is how the fundamental frequency can be obtained instantaneously and automatically from a signal. Say, for example, a laryngograph signal like this. It's converted from LX to TX and FX. The laryngograph signal would give an idea about the frequencies changes over time. A duration of a single TX, a duration of a single cycle, is obtained as the difference in time between the start of one cycle, the closure of the vocal folds at one cycle, because that's easier to identify, and the closure of the vocal fold in the succeeding cycle. And this will give the time duration of one vibratory cycle, a fundamental period TX, from which it's easy to obtain the fundamental frequency. It's the inverse of the fundamental period. Now, obtaining the instantaneous fundamental frequency at different times can be plotted into an FX contour, where here the x-axis is time and the y-axis is the fundamental frequency at that particular instant. So in this segment, when you have a higher than usual activity with higher fundamental frequencies, you can see high values of fundamental frequency in that time. When things start to change, slow down the fundamental frequency here, the fundamental frequency slope of the contour changed, and when it is very low in this segment, it's obviously lower at this segment. So a fundamental frequency contour is obtained by plotting the instantaneous fundamental frequency values against the time at which they occur during voicing. And from these fundamental frequency contours, the plotting of the fundamental frequency value against the time at which they occur during voicing, you can get a good estimate about the changes in the fundamental frequency over time, the range of the fundamental frequencies used between the maximum and the minimum, and how regular or irregular the phonation was. The next question would be, for how long does this individual uses certain frequencies? Which frequencies is he using most? Which frequencies he is using less? How long he would use high frequencies, and for how long he would use very low frequencies. For this, we convert the speech fundamental frequency contour into a speech fundamental frequency histogram, where the x-axis are frequencies and the y-axis at the time spent during voicing these frequencies. The x-axis is divided into columns called frequency bins. These columns have a very narrow frequency range, and every time the speaker uses this very narrow range, it would be included into the corresponding column. The columns are equally spaced according to the octave, the semitones, and the quarter tone scale, because this is how we perceive changes in the vocal pitch. So we would know from this that this individual speaker had used these two frequency bins, this narrow frequency range, most of the time, and he uses less the very high frequencies and the very low frequencies. We can also estimate which frequencies he is using for 90% of the time by excluding 5% here and 5% there, or 80% of the time by excluding 10% here and 10% there. So we know something about the frequencies he is using most of the time. And that's how the mean speech fundamental frequency is estimated. From the histogram, we would know where exactly is the central tendency for the frequencies used by an individual, and we'll also get an idea about the range and the standard deviation. We would know that if the mean speech fundamental frequency is shifted to the lower frequencies, that there may be an increase in the vocal fold mucosa mass, with conditions such as polypoidal degeneration of the vocal folds, rhinic edema, or hypothyroidism. Or if the mean values here shift towards the higher frequencies, we would know that there is increased scarring or stiffness of the vocal folds, puberphonia, and also laryngeal cancers, and some cases of recurrent laryngeal nerve palsy. There are technical difficulties in identifying the speech fundamental frequency range because of errors and misidentification of the upper and the lower parts of the spectrum. There are usually technical artifacts in the upper and the lower parts of the speech frequencies used. For this, the use of a histogram like this, we can concentrate only on the 90% of the frequencies used and omit the top and the bottom 5% on each direction, or we can use an 80% rather than a 90%, concentrating more toward the central tendency. This is to avoid the artifacts in recording the higher and the lower frequencies. And it's called a dynamic speech fundamental frequency range, and the DFX1. And from such a histogram of the speech fundamental frequencies, the DX1, we can identify problems with the speech fundamental frequency range, the range of frequencies used during speech. If the speech fundamental frequency range is restricted with a narrow base like in here, we think about organic problems in the vocal folds, or neurological problems like Parkinson's disease, in which the individual would use only a narrowed range of speech fundamental frequencies, or psychological problems like depression and to some extent schizophrenia. Also, some individuals with some problems in controlling of the vocal folds vibratory pattern, with irregularities in the pattern, they will empirically find that narrowing up of the speech fundamental frequency range would cover up for such irregularities. On the other hand, a wider than usual range could be normal in individuals who have exaggerated use of their dynamic range, or it may reflect dysphonia. Another parameter of interest is the variability and the speech fundamental frequency. We can calculate from the histograms the average distance between each frequency and the mean speech fundamental frequency. That is to say, we can calculate the standard deviation of the speech fundamental frequencies, the average distance between each individual reading and the mean speech fundamental frequency. This is the speech frequencies standard deviation, the pitch sigma. And this reflects a degree of the variability in the speech fundamental frequency. But a better way of identifying variabilities in the speech fundamental frequencies is this: the difference between DFX1 and DFX2. DFX1 is the histograms we have been through so far, which identifies how often a certain individual would be using certain narrow frequencies. So if he is using these frequencies most of the time, the average or the mean speech fundamental frequency would be here, and he uses higher and lower frequencies less. This is marked here as the red histogram. On top of the red histogram, you can overlay another histogram, the DFX2, which contains in these bins the pair of successive frequencies that have been used during the utterance of this frequency. So all the frequencies in this column would be analyzed if the successive of the following frequency for all these frequencies are no higher or no less than 10% from the first frequency, then it can be counted in the second histogram, the DFX2. So the closer the second histogram to the first, the better, because that would indicate that successive frequencies are quite close to each other, which gives a smooth voice, a smooth vibratory frequency change, and a good voice. So this would give an idea about how close are the successive frequencies to the original frequencies obtained from the DFX1. And the closer the two together, the better for the voice. Looking a little bit more closer at these histograms of DX1 versus the DX2. The DX1 would mark all the periods spent at this very narrow frequency band or frequency bin. So you could see that the individual had used these frequencies much longer, much more frequent than using frequencies on the upper or the lower end of the scale. On top of this red DX1 histogram, we have overlaid the black DX2 histogram, which only marks, rather than all the periods spent in this frequency band, only the frequencies here that has been followed by a similar frequency. If the following frequency vibratory cycle is no more than 10% up or down from the original frequency, then it will be counted in the DX2, the black histogram. So in an ideal situation, when all the frequencies are followed by a similar frequency, no more than 10% up or down, then the two would be very close to each other, the DX2 and the DX1. But if the DX1 only contains a small amount of the frequencies here, this means that most of the time the following frequency was quite far from the original frequency. From the difference between the DX2 and the DX1, we can measure something called the coherence percentage, which would come to it in a second. The coherence percentage is the number of the samples in DFX2, the black plot, divided by the total number of the samples in the same bin on the DFX1 bin, multiplied by 100. The closer the number of samples in the black to the number of samples in the red, the better for the voice. So if you have very low coherence, then this would indicate poor voice quality, because there is quite a difference between individual vibratory cycle frequencies and the preceding or the following frequency. Another way of plotting the regularity or the irregularity of the fundamental frequency is this scatter plot, the CFX plot, in which the frequencies, all the frequencies, are plotted on the x-axis, and the immediately following frequency would be plotted on the y-axis. So say if we have a point here, a frequency at a point 100 Hertz, the following cycle, vibratory cycle, if it has an identical frequency or quite close to it, the plot, it will be plotted somewhere close to the diagonal line in the scatter plot. But if it has a widely different frequency, the successive vibratory cycle has a widely different frequency, it would be off the diagonal line somewhere in here, for example. So at the end, if we have all the frequencies plotted against all the succeeding vibratory cycles frequency, if we end up with a neat line along the diagonal here, this is normal voice. If we have much scattering of plots around the diagonal, then this would indicate a degree of irregularity of the speech fundamental frequency. So this scatter plot, the CFX1 plot, reflects the cycle by cycle change in the vocal folds vibratory frequency. If the succeeding cycles have very similar vibration frequency, they would all lie close to the diagonal in here. These are scatter plots of a patient who had recurrent laryngeal nerve palsy before the thyroplasty and after the thyroplasty. Now, before the thyroplasty, you can see how the points are scattered away from the diagonal. Things had improved after the thyroplasty, and now most of the dots are aligned either along the diagonal or quite close to it. So you would expect a better voice in this condition than before the thyroplasty. Can this scattering of the diagonal be quantified? Yes, there is a coherence percentage here in which the number of points off the diagonal by more than 3% either ways are counted against the total number of the dots. And if this number is much less than 100%, then this would identify the degree of irregularity of this condition. You would expect things to have improved here, with the number of plots off the diagonal are much less and much closer to the diagonal, so this would give an indication about improvement in the regularity of the vibratory cycle. Now this is to sum up how the graphs for a normal male voice and a normal female voice would look like. If it is the histogram of the speech fundamental frequency, you would see a central tendency here somewhere just more than 100 Hertz, and you would see the scatter plot are more or less, most of the points are around the diagonal, indicating that minimum cycle to cycle changes in the fundamental frequency. The same for the females. You would have higher frequency here. The speech fundamental frequency central tendency would be above 200 or so, and again the scatter plot would show that the line, the diagonal line, would have most of the points indicating a regular cycle by cycle variation in the fundamental frequency. And I hope by now we'll be better able to interpret this normative data for the mean speech fundamental frequency for men and for women. And as you can see that the mean fundamental frequency for reading or conversation are quite similar here, a little bit less in the females. The dynamic range here in octaves, and only 90% of the range. You could see that it is less than 1 octave for reading and just more than 1 octave for conversation for men, and similar values for females. The irregularity and cycle-to-cycle variation in the fundamental frequency is about 12% for men reading a passage, but a bit higher during conversation. About 1/4 of the fundamental frequencies would be very varied from the preceding one. Much less variation would be seen in the females, who have either reading or conversation much less values than the men. The mean contact quotient had been discussed in the presentation on the vocal fold contact mod, and we know that it should be somewhere between 40 and 70%. As you can see in normal voice men and women, it's between 40 and 70% contact of the vocal folds during the vibratory cycle. If it is less than 40%, this is usually a breathy voice, and more than 70% it's a pressed voice. The other thing here is the standard deviation of this contact quotient, and it is in this area of 6% or 7% for men and women. By this, we come to the end of this presentation on what is a normal voice fundamental frequency. Assalamu alaikum.